The Movement for Global Mental Health has been designed and developed by a group of over 60 mental health professionals. Its aim is to improve services for people with mental disorders worldwide. It wants an increase of treatments for global disorders, for the human rights of those affected to be protected, and for more research in low and middle income countries.
The movement is, we think, a hugely exciting new development. It arises out of a series of articles published in The Lancet 1 year ago on global mental health. And the Lancet series articles identified a real problem, that there was no prioritisation of mental health within the healthcare systems, particularly in low and middle income countries. There's a huge burden of these disorders. We think that around about 14 or 15% of all of the total burden of disease arises from mental health conditions. But particularly in poor countries, only about 2% of the health budgets are being directed at this problem.
The report's authors argue that mental health awareness should be fully integrated into all aspects of health and social policy making. The next phase of the initiative is to increase the range of science being used, attract more funding and influence policymakers.
If we take the example of the HIV movement, for example, there were many similarities. Perhaps 10 or 15 years ago, people living with HIV were marginalised, the condition was hugely stigmatised, there was a lot of discrimination. But people gathered together, they united with a single voice, and the advocacy was tremendously effective. So people living with HIV demanded that national and global public health policymakers attended to the problem and closed the treatment gap. And we've seen what an enormous revolutionary change has occurred as far as the treatment of HIV is concerned, even in the poorest countries, and the level of international support that has been accorded to that process. We would like to achieve a similar success as far as mental health was concerned as well.
The launch of the group coincides with a major new initiative from the World Health Organization on mental health.
They've got a set of low and middle income countries which they're going to be using as demonstration centres. They're going to be providing technical support in order to develop the systems, the ways in which mental health care can be delivered in the community, principally by people who are not specialists.
A report on the movement's progress will be given at a global mental health summit taking place in Athens at the World Forum on Mental Health in September next year.